Hello and welcome everyone. We are happy to be joining you all here for our conversation on nurse education and research. We have the privilege of being joined by three esteemed nurse leaders in planetary health today to discuss these topics related to both the past, the present, and the future direction. I want to start by introducing myself. My name is Dr. Angelica Walton. I am the Director of Center for Planetary Health and Environmental Justice at the University of Minnesota School of Nursing. I'm also a clinical assistant professor in the School of Nursing as well. Just for a little bit of kind of ground setting on our format today, we're going to do a Q&A style for these next 60 minutes together. And so we have some posed questions that will rotate around the panel to have dialogue about. But I am going to start by introducing our panelists, and then we will jump into questions. So first, I would like to introduce Dr. Barbara Astle. She's a professor and associate dean of the master's program at Trinity Western University. She's been a pioneer in the planetary health education framework establishment and also as editor of the Canadian Fundamentals in Nursing. She's a nationally known researcher who has led the Canadian National Survey on integrating planetary health into nursing curricula and pedagogical practices. She's also a very well-known policy leader who has co-authored and co-collaborated on the Kane Position Statement on Planetary Health that recently endorsed the International Council of Nurses, and an award-winning advocate. She was recipient of the 2024 Excellence in Nursing Award for Planetary Health and an inductee to the Canadian Women in Global Health. So before we proceed, I just want to say that Barb, with your deep leadership and institutional engagement and framework development, we're so glad to have you here, have your wisdom here at the table. And I want to offer this opportunity before I introduce our next panelists to invite you to add anything I may have missed that you would like to elaborate on. Tell us a little bit about your current focus. Where are you coming from? Where are you located right now?
Well, thank you for that lovely introduction. I'm always kind of embarrassed, but thank you very much. Um, I just want to acknowledge that I'm on the unceded traditional territories of the Stalo people, and I'm so grateful to work and live here. As well, you know, I really don't think there's all that much to say, but because in some of the questions you'll hear more about the work that I've been doing in planetary health. But I will mention that one of the things that I do have a kind of three pillars to my work and my research, and I have a large transdisciplinary group, and you'll hear more about it on albinism and human rights. I also have a large pillar on planetary health education, as well as the third on research literacy. And I think I'll just leave it at that. So thank you again.
Excellent. Thank you. Thank you. And looking forward to the conversation and getting into that today. The next panelist that I would like to introduce is Dr. Gina Friel. She is the director of the Global Nurses Work Group and also a pediatric nurse practitioner. She's a global educator, founder of Nursing on the Front Lines of the Climate Crisis courses, which I know she's going to talk a little bit about today. And these courses have reached over 3,000 nurses across 133 countries, which is quite impressive. She's been a resource architect, serving as one of the first nursing fellows at Columbia University, working with the Global Consortium for Climate and Health Education, where she helped to co-found the Nursing Climate Resources for Health Education. And so we are so grateful for that work that you have led. And she's been a climate influencer, honored as one of the 2025 Time 100 Most Influential Climate Leaders for her work in global nursing mobilization. And really, she's been a clinical voice, maintaining an active practice as a pediatric nurse practitioner on the ground and with the people, with the children, bridging the gap between global climate policy and bedside patient care. So, Gina, your work in really scaling education globally is unprecedented. And we are so grateful to have you here and lucky to have your wisdom to learn from. So I will offer it up to you to add anything you'd like to about where you're coming from today and how you're showing up into this space.
I just like to say thanks, Angelica. I'm so happy to be a part of this conference, this worldwide conference. So hello to everyone out there. Good afternoon, good morning, good evening to all of you joining us from across the globe. It's just such a pleasure to be here, and I look forward to talking more about some of the things that we're going to get into a little bit, and giving you my clinical perspective as a pediatric nurse practitioner. I'm looking forward to it. So thank you so much, and I'm happy to be here.
Yeah, welcome and thank you for that. We're looking forward to it as well. Our third panelist that I would like to introduce is Yvonne Mongare, and I have the privilege of working with Yvonne in many different ways. She is a senior BSN student. She's in my leadership class right now, but we also work in a lot of global advocacy spaces together as well. Yvonne is a force of nature. She is a next-gen advocate, fourth year nursing student, about to cross the threshold here in May. And she's really been focused on the critical intersection of health equity, environmental justice, and public health policy. She's also quite the community organizer. She brings a very unique and dual perspective to this panel today, blending hands-on experience as a current CNA and also a grassroots climate resilience worker and contributor to the environment. She's a policy contributor. She's developed key policy recommendations. She's published chapters in the recent release of the Sigma Top 10 Actions for Climate Health book. And she is also a current, I will say, and future leader. She's dedicated to creating sustainable nursing solutions that safeguard underserved populations from environmental health risk. And she is currently serving as the youth director of the Planetary Health North American Regional Hub. So with that, Yvonne, we are so excited to have you here. You represent the very students that we are discussing today and hoping to reach and connect with and talk about where do we go from here. And so we're just really grateful to have you. And I want to open up the space for you to add anything and just tell us what university building are you sitting in right now? Where are you?
I love that you're asking me that. I'm currently in Moose. I just had my nursing. We have like a preceptor clinical practicum with reflection course, and mine is at towards the end of the day. So I needed to find an empty classroom. So yeah, I'm sitting here, but I'm really looking forward to this panel. I think having a student perspective is always very imperative to all the research and education we do surrounding planetary health. So I'm super excited for a conversation today.
Yeah, me too. So with that, we will go ahead and get started. I'll pose the first question, and if we can kind of go maybe Barb, Yvonne, and then Gina for this first one, we'll rotate through. The first question that I have for you is, what is one active learning strategy you've seen successfully bridge the gap between environmental theory and nursing practice in your time? And you'll each have about maybe 3 minutes, 2 to 3 minutes to answer the question. And I'll give you a reminder. I have a little 1 minute, but you can't really see it. I'll put my hand up.
Oh, okay. Well, thank you very much. And yes, I'm delighted to be here with everyone. And I don't know if I mentioned I'm coming from Canada. So I think that we're just a global group here. Just want to at the outset just say many of my responses really for the questions that we've been posed today are based on my role as a nurse educator. And I, in the curricula in our university, I've been teaching both an undergraduate and graduate planetary health and global health course since 2018. So, and it's also open to all students on campus. So it's just not nursing students. So when I have students from the arts and biology and whatever, I make some modifications on some of the assignments. And I use a lot of activities to engage my students to understand that interconnectedness to the ecological systems of nursing. So I'll try to be quick, but I'll just tell you I've developed modules over the last several years. I use a flipped classroom. So all the students come into class, engage in a number of modules before they get to class, because my classes are very active. So just giving an example for the first class is like, what is planetary health? But it's not only that, it's what are all the other definitions? One health, go on, public health. And so they go through various modules and they have to write these out. So when they come to class, one of the things is that we have one of the activities right at the onset. So I don't give it to them, is that we look at how do we define these various terms, and then we move into so what does that mean? And particularly in Canada, we've noticed that we're having wildfires much earlier than we. Just over the years, there's this increase in wildfires and the subsequent impacts on people's health. And so what they do through the course, and there's other activities, but that's one, is then I have them reflect. So these are students looking at you, Yvonne, and whether they're a nursing student or biology or wherever they are in my class, they need to write a little bit about what they've seen in the disruptions of something in their world. We've had some bad flooding, we've had heat domes, and how does that influence their own health and the health of the earth and those that they care for? And they do that in class. So that reflection is in class. And then I look at those later. And as the class goes on, I have a lot of other activities. So for this particular first class, I have 7 modules. The students become pretty, looking at you, Yvonne, they learn pretty quickly that they need to come prepared to class, because I am not a person that uses a ton of PowerPoints. I do use some, but we're very actively engaged in class. So this is just some of the examples, one example of looking at, and then moving it into the poly crisis, right? The social, economic, political context as we go along. But they need that foundation. And so and these students that I have are second year, just finishing second year. So new concept. So
I love that. I mean, you're really setting the container for that. Starting with that, how do we define, sets that container for safety, psychological safety, so that it can be invited curiosity that they have, which really is that transformative piece that I do think nursing education has to return to at some point. These more experiential, embodied ways of learning, being, knowing. So thank you for that. We'll pass the question to you, Gina.
So thank you, Barb, for that insight from the academic standpoint. As I said, I am a pediatric nurse practitioner, and I work in the United States in what we call primary care practice. So I see patients from birth all the way up through 22 years of age, and I see them when they're well, I see them when they're sick, and I actively try to incorporate the effects of a changing climate into my conversations with patients and families, depending upon how they present to me. If they're an asthmatic, if they are there for, they're playing a sport and they come in for a physical. So I try to pull in aspects of climate and health related to the visits that I am having with the patients and the families. And I try to, I think as nurses, we're so good at bridging the gap between complex science and our work with planetary health, and translating that into meaningful information that patients and families can take with them and utilize to promote their own health and the health of our communities. And I think it's important for patients and families to understand how changes in weather patterns and air pollution and vector-borne diseases can affect them and the communities in which we live. For example, when we see air pollution, we see more asthma and we see more respiratory illness. When there is extreme heat, and we see more heat-related illness, more emergency room visits. We see a decrease in quality and quantity of sleep. And, when there's drought and there's more water scarcity, In the United States, in Colorado, they this year have seen the lowest snowpack, record-breaking lowest amount of snowpack that they have ever had since record keeping began in the state of Colorado. And, one of the ripple effects of that is drought. And when there is drought, there is more of a risk for wildfires. And this can really lead to a cascade of events that affect patients and families, especially the youngest patients. I work with pediatric patients. And so just helping families to make these connections between human health and the health of the environment is just one of the things that nurses can do.
Yeah, yeah, I really appreciate that. And so it's kind of nice. We've got the academic, the format for learning matters, right? And then we've got the practice side where the format for how we connect with people, meet them where they're at, and really make the changes that are happening real in whatever ways those changes are real to them. Um, so thank you for that. And I'm curious to Yvonne's perspective on this from the student side of things. What's working? What's not?
Yeah, I think one of the most imperative things to me as a student when it comes to how do we even step foot into the planetary health sustainability space is making sure that the education that we're receiving is integrated across our undergraduate or master's or DNP programs. And you'll really get a sense of that because there's a difference between, when a class is just adding like a small section or an optional module video on a certain concept, and it could be anything. Um, you really feel that, okay, this might not be as important to my school to teach us on this, for example. So when it's something that's integrated into our education, our culture in general, students will come out of the said nursing program with that background already within them. And I also think a very important aspect too is, of course, like statistics and learning about just social determinants of health in general. Um, you hear so many different type of disparities that affect people, and especially environmental disparities. So I think personally, here in Minnesota, there's a trash incinerator that burns a lot of trash in the most diverse neighborhood within northern Minneapolis here. And as the person that, I grew up in the suburbs, I didn't live in the cities and I didn't come here until I came to university. I think giving students an actual feasible, like, okay, this is like actually happening within our community. If they're able to see that with their own eyes, or even within clinical, for example, like if you're seeing a patient that lives in said neighborhood, how can you teach them to have purified air? Or is there a specific resource that you have vetted yourself or you see that works for other patients that are in similar situations? So being an advocate for your patient in that sense, I think is equally as important in applying the education that we received through our undergrad. And yeah, again, I really do think so. Like if it's integrated like into all aspects of our learning, that's when I as a student see that this is a genuine point that, my school wants me to understand is really affecting my community. So I think both of those aspects are equally as important. And this applies to honestly any social determinant of health. So yeah.
hmm Yeah, I really deeply appreciate that the focus on you said something integrated into the culture, right? So not even just the curriculum. And that for everyone listening, really requires us to also start at the faculty development component as well. Ensuring that we have those resources available to our faculty who maybe haven't had the opportunity to formally engage with the material or content in this way so that we can ensure we're maintaining that integrity. So thank you for that perspective. The next question that I have for each of you is how do we best teach students to address the intersection of climate, pollution, biodiversity loss simultaneously? So, like you were saying, Yvonne, not seeing these things as separate, not seeing a random biodiversity module in your curriculum somewhere within your nursing programming, but how do we best teach students to address these complex crises at the intersection of them, at the root of them, and where they're connected. And we'll start this one with Gina and then Barb. Gina, Yvonne, no, Gina, then Barb, then Yvonne. Sorry.
Okay. Yeah, so again, I think no matter what our area of expertise as a nurse, no matter what our role is as a nurse, we can become skilled and into weaving this and integrating how changes in climate and biodiversity loss can affect us and our patients and our families. And Yvonne was just saying that, and I just like to reinforce that. So as my role as a pediatric nurse practitioner, I can easily integrate aspects of, for example, heat-related illness into conversations that I have with patients when they come in, when they're about to play a sport, or if they're coming in for a physical, to play a sport. Also some of our patients work outside, and heat-related illness is a thing, especially in the hot summer months. I live in the United States, and actually, just last week, we had 90-degree temperatures at a time of the year when we really typically see temperatures in the 60s. And so we're seeing heat at different times of the year and in places that we've never really seen it before. And so it's so important to discuss with from my perspective, that patients understand signs and symptoms of heat-related illness and what they can do to mitigate the signs and symptoms of heat-related illness. They can, drink a lot of water before and during and after practices and work and outside activities. They can know that when they're, how they're feeling, if they're feeling dizzy or lightheaded and or nauseous, those all can be signs of heat-related illness. And just so clinically, bringing this to life to patients and families and sort of relating it back to their specific activities that they find themselves involved in. And so, there's other ways in my role as the director of the Global Nurses Working Group, that we're integrating this into climate and health education for nurses. And I think that's so important that nurses learn how to do this at global institutions, across the world, and that it's not just a single standalone course, and that it's not just an elective, and that we're integrating it throughout the curriculum. And so that nurses that are not only the nurses that are taking the elective, but all nurses are exposed to this curriculum. And I think, case studies can be a really effective way of bringing nurses to the table and understanding that students can really solve a realistic clinical or community problem, and they can practice it, and they can incorporate more than one single environmental issue. Yvonne was mentioning the social determinants of health, and we can really bring this to life for our patients and our students. And it's so important that we do this, that we start to have nurses thinking in systems and not silos, and that they're thinking that these are not just abstract ecological issues, but they're really something that we're seeing right here, right now, today. And then through practice, we make this intuitive and not just theoretical.
Mm-hmm. Yeah. No, and what I hear kind of coming through on that is really demystifying all of this, right? And walking alongside our patients. Thank you for that. I will pass it to Yvonne to go next, and then I'm going to come to you, Barb.
Yeah, sure. I definitely echo what Gina was saying. I think the best way to really teach students to address the intersection is stepping away from the PowerPoints and getting that hands-on experience, whether it's like going out to actually advocate or um, like canceling your class and telling students to go watch, like a professor lectureship or, an outside professor that's coming in, something like that. I think it grows us as students. It gives us a sense of more leadership and more autonomy within our profession, even if we are still students. And yeah, just teaching students that the environment is, all around us. It doesn't have to like literally be environment, but it affects all of us. And especially like, if you're working in a nursing setting that isn't even inpatient, there are still different aspects of disparities that will affect you. So I think as a nurse as well, just researching what resources are actually working for your community and sharing them as much as possible. I find that to be the most integrative, because a lot of times there are resources out there, but it's hard to see what actually applies to you, how you can use them, if they're still active. So us having that background knowledge, I think, is equally as important. So yeah.
Mhm. Yeah, thank you for that. Multiple modalities and opportunities to learn in different ways and plays a big role in that social
Yeah.
development and adaptation and engagement
Mhm.
that allows for that systems thinking to happen. And what are your thoughts, Barb, on this one?
Well, this is great to be following the two of you. This is fantastic. So, when we look at the triple threat, that's important. And I also, early on, want the students to understand the various planetary health boundaries as well. And that it's important that our health communities are nested, right, within Indigenous applications of traditional knowledges to planetary health. And so I've been very, very fortunate. One of the classes, I work alongside one of my colleagues who's Indigenous. We've been doing this for, I think, 7 years now. So we did some different modules, but one of the things is we really want the students to have this interconnectedness. I'm looking at you, Yvonne, learning, and the philosophy of Indigenous ways of knowing. So they do some modules ahead of time. And one of, we really want them to understand the land is our teacher.
Hmm.
Water that cleanses us at birth. See how this relates to the triple threat and the other boundaries? Food that is gathered that feeds our community. The land teaches us how to be on earth, to not give into greed. The land heals us.
Hmm.
We have gifts to offer the land. We need to show others how to be entangled with the land again. And so what we do, we have a land-based activity that we do to get them to understand that connection directly with the land. And that's important because it directly impacts the climate, the air that we breathe, and the impacts on the well-being of us as humans and the planet. And you've both given some excellent examples. So there's this understanding of this reciprocal relationship that we have with the land. So in order to engage with it, one of the things they have to do before class, they have to go walk outside somewhere. Like you said, Yvonne, do something. So they have to walk outside, take a look around at nature, and they have to bring something to class that's least disturbing as possible. And they bring that to class. And to kind of imagine what the nature look like, and what might this look like 200 years ago, and what might this look in the future, getting them to think about. So that when they get to class, my colleague goes around, and it honestly takes the whole 3-hour seminar. That's why they've got to be prepared. And the students talk about what they got and what that means to them. And some of it has been outside their home, or some of it's outside the university, or whatever. And then we take a photo of it all, and then everything goes back to nature. So
Mm.
whatever we take goes back. So it's this interconnection to the land and what that gives us. And as we know, Indigenous ways of knowing, they've been doing traditions for many, many years. And if we were to adapt many of those traditions, we might not have some of the forest fires that we have in some of our beautiful parts of nature. So I'm just going to stop there. And I think that just gives another vantage point of when we look at these particular concepts and how that can be meaningful.
Yeah, really, really deeply appreciate that. I feel more settled in my own soul just talking about it. And yeah, we do a lot of that at the U as well, that immersive nature-based return. And it is true. If we would follow our Indigenous leaders in this space, a lot of our problems would resolve themselves as the natural world does. For the next question, I want us to kind of shift our focus a little bit towards research. And so the question that I have for each of you is, where are the biggest opportunities for nurses and midwives to lead in planetary health research right now? And we'll start this one. We'll go Gina, Barb, and then Yvonne.
Thank you for that question. So, again, I sort of have a dual role. So, as a clinician, in my role as a pediatric nurse practitioner, in a primary care setting, I think one of the ways that I can integrate planetary health into my practice is by incorporating this into, again, my patient and family visits. So when, for example, by asking a little bit more targeted questions. So when, it's again that really hot summer day, asking patients, do you have access to air conditioning or a place that you can cool off in the heat? And, if there is a child that has asthma, just asking them if they, are exposed to heavy traffic or air pollution. Is there a safe space where you can go? Is there a green space where you can play? One of the big things I did in my doctoral studies were I looked at trying to incorporate screening questions for food insecurity into our primary care practice. And I came to that with the thought that, I was seeing a lot of children with overweight and obesity. And my intention when I started was to sort of, start to think about a way that I can teach them to eat healthy and exercise. But really, I think the area that what I found, what was highlighted the most is that if patients and families were food insecure, all of my teaching would be meaningless. And I really needed to know that first. And so utilizing that research in our clinical practice can really help to guide us. And we can start to see patterns in our community that emerge across our patients and that reveal the risks to our community and to our environment. And as a pediatric nurse practitioner, we can take this and we can really use it to bring to our leadership to highlight, this is something that we might need to start to look into, and this is something that our children are being exposed to, and we can bring it to our community and to our leadership. And that's sort of how I see that research coming to life in my practice on a day-to-day level.
Yeah, I deeply appreciate that. Food insecurity, food systems. If we could hone in on doing not only more research, but more translation science in that space, there's a lot of transformation that would come from that. I mean, even thinking about how we partner with local farmers and local food systems to promote a more circular economic model and more nutritious foods for the patients we're caring for that addresses the insecurity issue. So I couldn't agree more with that being an important topic for us. What about you, Barb? Where are you at on your assessment of what feels really important right now?
Well, I like the personal aspect that you gave Gina, because when we speak from our heart and tell those stories, it is just so meaningful. And I really appreciated what you said. So I'm going to talk to you about briefly two things. And when planetary health, we say, is transdisciplinary. So I actually really believe that nurses and midwives, and I am going to give another individual example too, because we can do work ourselves, but I'm also going to talk about, I think it's really important that we're collaborating and partnering with others, that we do what I call, like we can't be in a vacuum. So this is this participatory community partnered co-produced research. And so this is with our social scientists, with our Indigenous communities, which are knowledge keepers, social and behavioral scientists. And so to find solutions, and more importantly, to mobilize those solutions. So that's really important. And I'm going to give you an example. For the last decade, I have serendipitously been co-leading a global transdisciplinary advocacy policy partnership addressing albinism and human rights. And that's actually persons that lack melanin in their skin. And it involves various researchers from every different fields, civil society, faith communities, etc. And what's really been interesting in this work is that I identified that there's a real urgency, like there is for all of us, for persons with albinism, the impacts of climate change on skin cancer. So it's not only for all of us, but it's also particularly for those that are structurally vulnerable, depending on where you live in the world, where you don't have access to maybe, there's studies out there to have a tree that gives you shade. I mean, that can be just as good as an air conditioner. So what I have done is I've done a lot of research with this group, but I've also hived off the planetary health aspect. So I would look for nurses in your work to see how planetary health affects everything that we do. And I like, Yvonne, how you said, oh, it's integrated. So do you see how in this research, all of a sudden I ended up identifying, and I could see that there's a lot of skin cancer in various parts of the world. And I said, we need to do something about this. And so some of you will know, I've written about it, and I've got another article coming out about this soon. So that's where we can work together and look at, when I say you've got social determinants of health, which is really, really, really important, but we can look at that distal, those structural determinants of health, the economic, the societal, the ecological, the political. So that is kind of some of the work I do with that. And you can see I get a little bit passionate.
I love that.
About it, yeah. And it's pretty incredible, this work we've been doing around the world with such a great transdisciplinary, interdisciplinary team. And in my also thinking about you, Gina. So I have a doctoral student right now, and she works in healthcare design. So for her research, she is using, and as far as I know, it's at the first, it's quite innovative. She's using a planetary health lens to explore how this can be used to construct sustainable healthcare facilities. And it's pretty interesting work. So that's thinking about you, Gina, what was interesting to you. And then when I sat down with her, and so we're really excited this work she's done, and actually it is being showcased in London, England at the moment. So just a preliminary sort of work that she's doing, I can tell you more about that. But there's two examples where we community-based, co-produce, work together, find those things as nurses, because we're all in this together. And then there's some of those others work that we do. And Gina, you gave an excellent example. Look forward to looking at that work. I might have already looked at it. So thank you.
Yeah, thank you for that. And you really kind of focused in on both of those examples that you just gave, the structure, right? Everything is happening by design. Everything that we're facing is happening by design. And whether it's looking at the structural determinants of our society or looking at the physical structures of our places and spaces and the environments that cultivates. Yeah, I could not agree more. I teach regenerative health system design, so and I would love to read the work that you are talking about. So I'll have to get you to email that to me, and we can share it out to the network as well. What about you, Yvonne? From your perspective, what do you feel is most critical, maybe a gap right now, that nurses could leverage as an opportunity to do more research and quality improvement on related to planetary health?
Yeah, I feel like the biggest opportunity within research from a student perspective is including them within a lot of leadership's research projects, anything like that, to be honest. And it could be internships, formal or not, just seek student groups, wherever like a student can put themselves in whatever they're passionate about, even if it's not necessarily environmental health, like it could be anything. Um, Nurses have a unique ability to be advocates for their patients. So I think it would be a disservice to your own patient population to not firstly understand your community and try to understand what resources are therefore needed. I think in my own journey, just throughout all of this, I find that it can be difficult as a student to even know where to turn to. I currently work within the Office of Sustainability as the Climate Resilience Public Health Task Force Coordinator. And it's a very unique role. And of course, as a nursing student, you might think, okay, how does that fit within the Office of Sustainability? But it's a beautiful mix because we're able to survey basic resources and how they affect our community, public health wise and mentally as well. But you can also bring in the climate resilience aspect and see, okay, what adverse weather events are happening short term, like today it was 100 degrees or 110 degrees, and over time that people are talking about, our entire community, nurses or not, we are understanding that there's change happening, but how can we interpret this share to other people, and provide the proper education, resources, and emergency preparedness that they might need. And I think another critical aspect too, and this might just be like with my own personality, but I put myself in places where I might not belong. Because this role initially, I applied for it, and it's technically only for grad students. So I think as a student, you should try to get yourself in any doors possible, even if, you know, the role isn't defined for you. Email people, see where you want change, where you feel passionate, you know, creating change within your own nursing career, and make it more meaningful, not only for yourself, but for your own community and whatever you stand for. So I think that's the most imperative way to get students in the door with research opportunities.
And this is why you're a pioneer, Yvonne. You are leading the charge, and that applies to not only students, definitely students, but nurses as well. Put yourself in spaces that, you know, we haven't been or are not maybe seen as the norm, as being a part of that infrastructure, that interprofessional infrastructure, because that is what we need in order to actually transform the system. But I like that you focused, you know, really on inclusivity as the format for the research and the QI work that is happening in this space with nurses
Mhm.
could be a lot more inclusive of community partners, inclusive of nurses at the bedside, and also of students to help foster that more holistic approach of what's going into how the research is being done. So I appreciate that a lot. Um, where we at on time? We're looking good. The next question I want to ask is, how do we ensure health equity and environmental justice are central, not peripheral, to nursing education? So you might tell us about the intersection of policy and education, and how you're doing that in your work. And we will go to Barb, and then Yvonne, and then Gina.
Well, thank you very much. It's kind of a two-part the way I'm going to respond, but I thank you again, Yvonne, on this one project I have. I have 6 interns, and be happy for you to apply at the beginning of the academic year next year if you're interested. And these interns are part of this research. We've been doing that, having interns for a few years, and they're from all over the world: Tanzania, South Africa, Ghana, Canada, United States. So look forward to seeing maybe your application. And that is really, it just resonated with me. So I had to say that. So I do have a specific class and where I ask, what is environmental racism? And what is environmental justice? So what they do is, before that, again, they have to complete these modules. And one of them is they listen to a module or listen to a video, you might find this interesting, on environmental racism by Dr. Ingrid Waldron. She's a social scientist in Canada and has been one of the leaders in there. And there's something in the water. You may have heard about that. Then I also have them do some other readings on environmental justice and frameworks, and they need to write some of those things out. And so to make the connection between health equity and environmental justice, I often lean on the work of Stephanie Nixon. She's actually a physiotherapist by background, Canadian. You may know about it, the coin model of allyship. And so it talks about those on the top of the coin have privilege, and those in the middle is the system of inequality, and those on the bottom is oppression. So it's kind of a really neat way to link these racism along with this privilege and oppression. And it takes quite a bit of time to do that activity. And then what I do is I have them reflect on Dr. Ingrid Waldron's what the evidence that she has provided about these populations. And I won't go through it in detail, but she talks about how, and you've alluded to it at the beginning, Yvonne, where there's structurally, certain populations that are structurally impacted by where they live. So if there's a pulp mill and there's the effluent, polluted water going to the air, who lives in those areas? And she talks about that. And so they need to reflect on that. And then when I move that, so it's part of their education, one of the things is that in Canada in June of 2024, and this is very, very significant, that there was a national strategy respecting environmental racism and environmental justice in Canada. And a lot of that work was pivotal policy work by Dr. Ingrid Walton. So I want you to know that that work is continuing, of course, but that is an example of something that is moves policy, this into action. The other thing in the Canadian Nurses Association Code of Ethics for Nurses 2025, we have an ethical imperative in there calling for social environmental approach to advocate for environmental sustainability alongside health equity. So I like to bring that up and show you. And the other thing you alluded to at the beginning, and Angelica, is that Dr. Teddy Potter, and Dr. Heidi Hegniger-Rogers, and Erica Burton, who I've been working with for a long time, many of you know, and published with them. We had the Planetary Health topic brief, which we unveiled at the International Council meeting in Helsinki last year. So that's another way of, and in that is quite a comprehensive document where, again, we're mobilizing some of these concepts. And then just even in my own country, you know, shout out to some of my colleagues that also have taken some, you know, positions relative to, you know, we have what's got the dangers of fossil fuel fracking. And so we've had nurses have been bringing that to the forefront. And I know it's Canadian Association of Nurses for the Environment, along with Canadian Association of Physicians Environment, but I also know similarly, your group, Annie, has done some great things. So those are just a couple of examples of the policy, but how I bring that to life in the classroom. Thanks.
Yeah,
go ahead. Thanks.
Those are great. And I think like it's weaving the thread on a lot of things that we've talked about thus far, even going back to the first question and your examples of how you're doing that interactive and immersive learning. Because at the root of all of this, right, is returning people to that sense of care and respect for life. And starting with those embodied ways of knowing is how students are able to get to the point of understanding the connection of policy and going into more obscure roles as a nurse in spaces and places to be able to transform the system and do that. So just seeing a lot of connections happening in this web of the conversation that I love very much. Yvonne, we'll pass it to you next. What are your thoughts on this?
Yeah, I think one of the most important aspects is having a systems mindset and understanding that we are stewards as nurses. So, you know, as nurses and nursing students, we're taught we need to follow policies. And I think when it comes to environmental justice specifically, we have to be stewards of change. So not necessarily following the process or the rule books, but being able to question the systems that are in place within our hospitals and propose a better way if it's not working. And I think that's honestly something that's very prominent amongst Gen Z right now. Like, we are not settling for what's not working. I also think protesting and local advocacy is equally as important. I find it, and I think legislators as well find it more impactful to them when they actually hear real stories of nurses students, and even young folks like children as well, taking time out of their day. They took a day off of school to come to the Capitol and say, we want this, we want more youth environmental justice education. It actually shows people that this is something that they desire, and it's a legitimate thing that needs to be changed. And lastly, I think kind of culturally, a very important aspect is just early education. When we teach our young people that environmental justice and planetary health as well is something that affects all of us, even if you're in healthcare, if you're in finance, whatever you might, you know, eventually go into. If you find alternatives or greener processes to the way that you live your life, and again, you're not settling for the processes that are there, you're fighting for your own future, and you're changing the culture around the climate crisis. So rather than being in a crisis, like, I don't know what I'm gonna do, like this is the end all be all, we're like, no, we're gonna actually change the process. It doesn't have to be like this. I think that's the most important aspect right now. And obviously changing, shifting a culture is very difficult, but starting young and teaching young students like, okay, this is something that's actually happening, like very hands-on type of learning. They can take it with them personally. They don't even need to hear the word, oh, climate crisis, because they'll know they've experienced it already.
Mhm. Yes, changing culture is big, but it's happening and you're a part of it. We're all a part of it. So
Yeah.
now pass things to Gina.
Wow, you guys have set me up so beautifully for what I was going to say. And I think this is such an important question. And I think I like to approach it from that what nurses are taught in school and the core determinants of, pediatric health are integrated into practice and move away from considering this type of thing, planetary health and how climate, affects our health and considering it part of the curriculum. And by aligning our teaching and policy and professional standards that align with, what nursing institutions are teaching. And I think the American Association of the Colleges of Nursing Essentials, have outlined the necessary curriculum and content and the expected competencies of all graduates of nursing curriculum and just having this as a foundational pillar and not as, again, as an elective, as I sort of mentioned, and I believe that first question. And in the United States, the National League of Nursing in 2022, they developed a vision statement for offering recommendations for the integration of climate and health into curriculum. The International Councils of Nurses, the ICN, the American Nurses Association, I think, Canada has done a really good job, and our colleagues in Australia have done a really good job. And so we're starting to see organizations at the highest levels starting to recognize the importance of integrating this into our nursing education. And having said that, I would like to call on the other nursing organizations leaders in the United States and across the world to prioritize the setting of standards to include the integration of climate and environmental health as imperative in nursing education for, not only for future generations, but also those of us that are in practice that never really had it as part of our curriculum. And this is where policy and education intersect. The policy really defines what nurses are accountable for, and our education determines how nurses are prepared to meet that responsibility as an essential component of our nursing practice. And so it's so important that the nursing leaders across the world are beginning to integrate this. And I think that's our big word of the day, integration. We're already doing so much of this. Now we just have to sort of frame it.
Yes. Yeah, that is a beautiful segue into just kind of a final question for a few words to wrap us up here to leave us in a hopeful, visionary space. So this final question that I have is, it is now year 2030, which is only 4 years away, so we're not going that far into the future. And we have successfully integrated planetary health into the DNA of every nursing school in the North American region. Maybe we want to say the world and the global community. So when you look at the new nurse of 2030, what would be the most inspiring thing that you see in your vision that they're doing, whether it's at the bedside or in the community, that gives you hope for the future? Because if we could see it, it will become real. And I don't have an order for this one, so anyone can go.
I'm happy to go.
Yeah, go for it.
I think nurses nurses are trusted, they're smart, they're caring, they're astute advocates for patients and families. And I think in 2030, I still want them to be that. I want our nurses to be leaders in the field and better trained to see the bigger picture through an environmental lens and still advocate for our patients and our families. And what gives me the most hope is not just the knowledge of nurses, because I think nurses have the knowledge. It's going to be their sense of responsibility as advocates in championing, the health and well-being of children and adolescents and young adults and underserved, and keeping in mind equity and environmental justice and all those things, and now just integrating it
Mhm.
into whatever role a nurse finds themselves at all levels of nursing expertise, and that's my vision.
I love that vision. And what about you, Barb? What's your vision?
I'll go next, and then I'd love Yvonne to, well, my vision is similar to you. I'm always hopeful. And I see, Yvonne, when I look at you, and you could be my students, and just how they get so fired up, and oh, we're gonna go do this or that, and can you come with us, and that. And so I really do see you moving forward in some of this. What I also would like to say is that one of the things that I've been working on is, sometimes I feel like we do get a bit siloed. So globally, some of us really understand some of the issues and the challenges. We have nurses around the world who are also trying to unpackage some of this, and how do they integrate that into their practice and into their curricula. And that is something that we are still working on here in Canada. I'll tell you, we've got the mandates like you do in the United States. Other places don't have that. So my hope is that we can work alongside them to ensure that. And I think it is moving that way. And then also, one of the calls was, how do you do this? How do you make sure? So, University of Minnesota, you've been School of Nursing, such leaders in what you've done. I've been a champion in Canada in my little kind of area, along with some great other people across Canada. But it's a movement, and it's emerging. So I want to support our faculty. So I'm coming from an academic. I want to support them to know how that there won't be certain barriers in their way, and how can I work alongside them so that they can see how that is embedded within everything they do, as you talk about, Gina. So I start my first class actually before we say what planetary health is. We talk about hope.
Yeah.
So
Yeah.
I am a relational kind of person, and I want, at the beginning, Yvonne, if you read that first, I even play a song about hope, and because I want them to know that this is not all doom and gloom, right?
Yeah.
So what I would say is I want to continue to work alongside my colleagues around the world, my students everywhere, so that we have this shared understanding of looking after the health of all of us, the planet, all living Earth, human and health. Thank you.
Thank you for that. And Yvonne, we'll pass it to you to round us out in your youthful hope and vision, and how do we go out and spread that?
Yeah, I definitely agree with Barb and Gina. I think hope is like the seedling that we all need to hold on to. And I think from a youth perspective, I find that when we're able as nurses to take our patients like environmental assessments, like understanding where they live, their access to nature, their quality of life, and really integrate that to all of our nursing cares, despite what type of setting they're in. Um, it's almost like a cure or prescription that our patients can use, and it's something that's normalized too. I think somewhere in like Europe, maybe it was Sweden or Norway or something, they had doctors that were prescribing like going outside or taking a vacation or something like that, which, that sounds amazing. I'd love for something like that to be more normalized, just taking more time off, taking appreciation of our environment, sitting in it. Um, And yeah, I think nurses as well, we can have communities or community hubs where, we're no longer advocating for things. It's like this is our normalization, like we have more tree canopies, there's more time spent outside, healthier eating, etc. So yeah, I think when I imagine an integrated planetary health education environment in 2030, I just see health equity and environmental justice at the crux of each other. So yeah, but very hopeful.
Yeah, beautifully stated and kind of encapsulating all of that. It's this
Yeah.
preservation of nursing, right?
Mhm.
The integrity and the empathy and the compassion and the loving energy that the act of nursing, that is nursing, that we get the privilege to do for work because we signed up to become a nurse. But really, it's the root of humanity, that nurses kind of bring that energy to the world, and it's healing and it's real, and how lucky are we to all get to be a part of it. So thank you each for being here today. That is our time. I am so grateful for your leadership, the work that you're doing, and I hope you get to enjoy some sunshine from wherever you are in the world for those who have been listening.